Welcome to the deep dive. Today, we're taking you straight into this really fascinating, booming, and honestly highly controversial intersection of women's health, cutting edge tech, and, well, a massive regulatory tug of war.
Yeah, it really is a tug of war.
It is. And we're unpacking the world of what is heavily marketed as quote unquote vaginal rejuvenation, but we have a very specific mission for you today. We are zeroing in on one highly targeted question, which is temperature controlled radiofrequency or RF actually a safer option for treating vaginal laxity?
And, to get to the bottom of that for you, we really have to cut through a lot of marketing noise. We
Yeah.
need to look at the actual clinical data and the regulatory frameworks because the stakes for millions of women navigating these options are just incredibly high.
Right, which is why we pulled from a massive stack of diverse sources today. I mean, we are looking at peer-reviewed clinical trials, including this really illuminating 62-woman randomized study out of Spain. We've got pilot studies, private clinic FAQs, and then on the totally opposite end of the spectrum, we are looking at these stern regulatory warnings from the US FDA and the UK's NICE guidelines.
And when you look at the sheer scale of the issue presented in all these sources, it's pretty clear why this technology is generating so much attention. I mean, for millions of women, vaginal laxity and a condition called the genitourinary syndrome of menopause, or GSM, it severely impacts their daily quality of life.
Yeah, we're talking about real physical discomfort here.
Exactly. Physical discomfort, chronic pain, emotional distress. Finding a safe, non-hormonal treatment isn't just about aesthetics for these patients.
Yeah.
It is a critical medical pursuit.
But before we can even evaluate the safety of the technology itself, we kind of have to look at the physical reality of what it's actually trying to fix. And the sources point to two major life events that alter this tissue, which are childbirth and menopause. Childbirth obviously causes like mechanical stretching and acute tissue trauma, but the sources actually spend a lot of time on menopause, specifically highlighting hypoestrogenism.
Which is that really steep drop in systemic estrogen levels, right?
Exactly.
And that drop in estrogen fundamentally alters the cellular landscape of the vaginal tissue because estrogen is essentially, it's the biological maintenance signal for that entire area.
Okay.
So when those levels plummet, the tissue loses its elasticity, collagen network begins to break down, and local blood flow just significantly decreases.
And reading through the clinical descriptions of GSM in our sources, the resulting symptoms are severe. Like the loss of that structural integrity leads to laxity, which is that feeling of looseness. But it also causes severe dryness, irritation, and dyspareunia.
Which is the medical term for painful intercourse.
Right.
Yeah.
And the sources also link this tissue breakdown to stress urinary incontinence, where, just a laugh or a sneeze causes urine leakage.
And those symptoms present a really complex challenge for physicians, particularly because, well, a lot of women either cannot or just choose not to use systemic hormone replacement therapy.
Yeah, which is a huge factor.
It is.
Yeah.
And this is the exact gap in care where radiofrequency technology enters the picture, basically claiming to reverse these structural issues without using hormones.
Now, I have to say, when I first see the word radiofrequency applied to biological tissue, my mind instantly goes to, like, microwaves.
Oh, sure, yeah.
It sounds like we are essentially microwaving the tissue to tighten it, which, frankly, sounds terrifying.
It does sound scary when you put it that way.
Right. But looking at the physics in our sources, it operates on a completely different principle.
It's a vital distinction. So RF does use electromagnetic energy to deliver a high-frequency current into the tissue, but it is not cooking it from the outside in like an oven would. The thermal effect is actually achieved through something called the oscillation of intracellular ions.
Okay, let's translate that for the listener because the mechanics here are honestly fascinating.
Yeah.
So the RF wand is sending electromagnetic waves into the tissue, and those waves cause the charged particles, the ions inside the cells, to rapidly vibrate or oscillate, right?
Yeah, exactly. And that rapid vibration creates resistance within the tissue itself, which in physics is known as impedance.
Okay.
Because the tissue is resisting that rapid cellular movement, it generates heat. So the tissue is essentially heating itself from the inside out in a very, very controlled manner.
Which brings up the obvious question, I think. Why do we want to heat up tissue that is already traumatized, thinning, and lacking collagen?
It seems counterintuitive.
It does. But according to the literature, this controlled heat acts as a catalyst for a natural inflammatory cascade. It causes vasodilation, forcing more blood flow to the area, but the main goal is to stimulate the fibroblasts.
Right, and fibroblasts are basically the workhorse cells responsible for producing new collagen and elastin. By introducing this specific heat, the RF energy triggers a process called neocollagenesis.
Making new collagen.
Exactly.
Yeah.
But the most crucial detail across all our clinical sources is that this entire process completely hinges on hitting a highly specific clinical target temperature.
Yes. The absolute sweet spot mentioned repeatedly in the data is between 40 degrees and 45 degrees Celsius.
Right.
And for those of us using Fahrenheit, that's roughly 104 to 113 degrees.
And operating within that really specific thermal window achieves what the sources call cellular biomodulation.
Cellular biomodulation, which is essentially just a fancy medical way of saying we are altering the cell's behavior without destroying it, right?
That's spot on.
We are heating the existing collagen just enough that the triple helix structure unwinds slightly, which signals the body to build brand new, tighter collagen. But we aren't heating it so much that the tissue actually burns or, forms destructive scar tissue.
Yeah, that is the defining mechanism here. It's biomodulation rather than thermal destruction.
Yeah.
You're commanding the local cells to rebuild their own structural matrix by simulating a very specific low-level thermal stress.
But practically speaking, this introduces a massive logistical hurdle. I mean, if 40 to 45 degrees Celsius is this magic narrow window where biomodulation happens, how does the practitioner ensure they don't overshoot it by a degree or two and cause a severe burn? We're talking about highly sensitive mucosal tissue here.
And this is the exact problem that temperature-controlled RF was engineered to solve.
Okay.
Our sources detail several specific devices in this category, including brand names you might have heard of, like Fermiva, Votiva, and Forma V. And the defining technological leap with these specific devices is the integration of built-in thermistors or thermocouples right at the treatment tip of the wand.
So those tiny sensors are basically constantly reading the surface temperature of the tissue in real time, right?
Yes, multiple times a second.
Wow, okay. So they're feeding that data back to the RF generator constantly. So if the tissue hits that 45-degree ceiling, the machine automatically dials back the current or just cuts the power entirely to prevent overheating. It is an automated safety loop.
Right, it theoretically removes a significant margin of human error. The device is designed to refuse to burn the patient, regardless of how long the operator holds it in one single spot.
I really want to contrast this built-in safety mechanism with the other major technology we always hear about in cosmetic dermatology, which is lasers.
Oh yeah, big difference there.
The sources bring up CO2 and ERYAG lasers, classifying them as ablative and fractional treatments. Fractional meaning the laser beam is like broken up into tiny microbeams to treat a fraction of the tissue at a time, leaving bridges of intact, healthy tissue to speed up recovery.
Right, that fractional approach is really common. But it's the ablative nature of those lasers that creates the starkest contrast with RF.
How so?
Well, ablative means the laser is actively vaporizing water inside the cells. It is purposefully creating microscopic injuries, like controlled microscopic burns, that physically strip away the superficial layer of the tissue to force a healing response.
So lasers are literally breaking the surface of the skin. They rely on creating physical damage to trigger regeneration. But our sources classify this temperature-controlled RF as non-ablative.
Exactly. Because RF relies on those fluid charges and internal impedance we discussed earlier, it passes through the surface without actually breaking it. It creates what they call volumetric heating beneath the mucosa.
Oh, interesting.
Yeah, and this non-ablative nature makes it broadly safer for all skin types and pigmentation levels because it isn't targeting melanin or vaporizing the surface. Additionally, our sources point out that RF energy conducts exceptionally well in well-hydrated environments, making the natural moisture of the vaginal canal an ideal medium for this specific kind of energy.
Okay, so if we look at this purely on paper, we have a non-ablative technology relying on the body's natural impedance with an automated computerized shutoff switch to prevent thermal damage. I mean, it sounds incredibly safe.
It does.
But if it is so heavily engineered for safety, how did it trigger a bombshell warning from the US FDA?
Yeah, that discrepancy is perhaps the most critical part of this entire deep dive. It highlights the massive gulf between how a medical device is engineered in a lab and how it is marketed and utilized out in the commercial world.
The 2018 FDA warning issued by then-Commissioner Scott Gottlieb did not mince words at all. The agency stated they were, quote, deeply concerned women are being harmed by energy-based devices being marketed for vaginal rejuvenation. The FDA cited reports of horrific complications. I mean, severe burns, blistering, scarring, and chronic pain.
And the first thing to really unpack in that warning is the term vaginal rejuvenation itself.
Hmm.
As the source is clearly established, that is purely a marketing term invented by the aesthetic industry.
Right.
It is not a recognized medical diagnosis, and it is not a standardized surgical or clinical procedure.
So if the wand shuts itself off automatically at 45 degrees, how are women suffering burns and scarring? Because synthesizing the clinical data with the regulatory warnings, a really clear through line emerges here. The danger often lies with the operator, not the engineering.
We really have to look at the regulatory gap that aesthetic clinics exploit here. The FDA clears many of these RF devices for general soft tissue heating or dermatological conditions.
Okay.
But once a device is cleared for general use, physicians can legally use it off-label. And the aesthetic industry took these general heating wands and aggressively marketed them specifically for vaginal laxity and sexual dysfunction,
Yeah.
which completely outpaced the regulatory bodies.
Which means you have non-medical med spas and aesthetic clinics offering these procedures. The automated safety switch on the wand is great, but as the sources indicate, technique still matters.
Oh, absolutely.
If an untrained operator uses improper settings or applies the wand incorrectly, adverse events can still happen. But reading deeper into the clinical literature, the far more insidious danger is poor patient selection.
Patient selection is everything in medicine. A qualified pelvic floor surgeon or a urogynecologist, they have the anatomical expertise to know who should absolutely not receive thermal energy treatments.
Right. If a woman walks into a commercial med spa, the technician might just see a paying customer asking for laxity treatment. But a medical professional might do an exam and find underlying conditions like active infections, undiagnosed pelvic masses, or, and this is a big one, previous pelvic mesh surgeries.
Yes, exactly.
Applying electromagnetic heat to a synthetic surgical mesh inside the vaginal wall could lead to the exact severe complications the FDA commissioner warned about.
And the UK's Women's Health Clinic actually released a statement responding directly to that FDA warning. While they argued that the FDA was perhaps a bit too broad in condemning all energy devices, they fiercely agreed on one core issue.
What was that?
The lack of regulation regarding who is legally allowed to perform these treatments is a massive ongoing safety risk. The anatomical complexity of the pelvic floor requires a trained diagnostician.
And if you are considering this procedure, that is the most vital takeaway from the regulatory side of our sources. Your safety is heavily dependent on distinguishing between a medical procedure performed by a physician who has evaluated your internal anatomy versus a purely aesthetic procedure performed at a commercial clinic.
Definitely. And with that regulatory tension in mind, we have to look at what happens when the technology is used correctly, in a controlled environment by qualified researchers. Like, what does the clinical data actually say about efficacy and safety?
Well, the clinical trial data we have is incredibly compelling. I want to look closely at that randomized clinical trial from the University of Castilla-La Mancha in Spain. They took 62 postmenopausal women suffering from genitourinary syndrome of menopause. And what makes this study so important is that it was sham-controlled.
And a sham-controlled trial is really the gold standard, particularly when evaluating treatments for sexual function or pain, which are highly subjective and very prone to the placebo effect.
Right, so 32 of the women received the actual temperature-controlled RF treatment, while 30 women received the sham procedure. They inserted the wand and basically went through all the motions of the treatment, but no actual electromagnetic energy was delivered.
And the outcomes were measured using validated medical questionnaires, primarily the Female Sexual Function Index, or FSFI, which measures everything from desire and arousal to lubrication and pain. They also used the Vaginal Health Index to measure objective tissue changes.
And the results were stark. The women who received the real RF energy saw an average score jump of nearly 6 points on the Sexual Function Index immediately after treatment.
That's huge.
It is. And even more importantly, that improvement held steady at the 12-week follow-up. Meanwhile, the sham group scores completely flatlined or declined slightly, which thoroughly rules out the placebo effect.
It proves the physiological mechanism actually works. The researchers noted that these improvements in sexual function and vaginal health occurred entirely independent of the women's estrogen status. Yeah, it validated that the non-hormonal tissue remodeling biomodulation we discussed earlier was actively repairing the mucosal structure. And critically, regarding the FDA's safety concerns, this trial reported 0 adverse events. No burns, no blistering, no scarring.
That perfect safety record is echoed in the pilot study we reviewed from Dr. Red Allensod in California, who utilized the Thermova device. His study also reported zero major complications. In fact, his patients were able to resume all normal physical activities, including intercourse, immediately after the procedure. There was zero clinical downtime.
So the data clearly shows that when temperature-controlled RF is utilized in a strict medical setting for properly diagnosed patients, it has a high degree of efficacy and a strong safety profile.
But this brings us to a massive contradiction in our sources, because despite these highly positive numbers from the trials, major medical bodies are still throwing up stop signs. If you look at the guidance from the UK's National Institute for Health and Care Excellence, NICE, they explicitly state that they do not recommend the routine use of these energy devices for vaginal laxity outside of formal clinical trials.
And the American College of Obstetricians and Gynecologists, ACOG, maintains a very similar, highly cautious stance. This hesitation from governing medical bodies basically stems from their foundational philosophy of prioritizing conservative, established care over novel technologies.
Right, because according to the clinical guidelines, conservative care for vaginal laxity doesn't start with a thermal energy wand. It starts with pelvic floor rehabilitation.
Yes, exactly.
It means working with a specialized physical therapist, utilizing targeted Kegel exercises, and structurally strengthening the underlying musculature.
And that structural focus is vital. Often, what a patient perceives as vaginal, quote, laxity is actually a symptom of a much more profound structural failure, such as pelvic organ prolapse.
Right.
This occurs when the supportive ligaments and muscles weaken to the point that the bladder, rectum, or uterus physically pushes into the vaginal wall.
And an RF wand that heats the surface mucosa to build collagen is not going to fix a torn pelvic muscle or a prolapsed bladder.
No, not at all.
It's like trying to fix the crumbling concrete foundation of your house by just putting a fresh coat of paint on the living room walls. The paint might look nice, but the house is still sinking.
That analogy perfectly captures why ACOG and NICE demand proper medical diagnosis. If a patient bypasses a doctor, goes to a cosmetic clinic, and receives RF treatment for what she assumes is just laxity, but she actually has an undiagnosed prolapse, she is losing money and delaying the surgical or physical therapy interventions she actually needs.
And beyond the issue of proper diagnosis, the sources point to one undeniable limitation in all the positive clinical data we just discussed: time.
Yeah, the timeline of the evidence is the primary reason major medical bodies withhold their endorsement right now. The Spanish randomized trial, Dr. Allensad's pilot study, and most of the literature surrounding these devices only follow patients for a few months, perhaps up to a year.
We know the 45-degree heat rebuilds the collagen in the short term, but we just don't have the longitudinal data to know how long that new collagen lasts. More importantly, we don't know the physiological consequences of repeatedly applying electromagnetic heat to this specific tissue over 5, 10, or 20 years.
And until that long-term safety profile and durability are firmly established in the literature, organizations like NICE and ACOG just will not issue blanket approvals for routine clinical use.
So, synthesizing everything from the engineering specs to the regulatory warnings, where does this leave you, the listener, if you are navigating this landscape? Well, the data shows that temperature-controlled radiofrequency is a highly promising, non-hormonal, non-ablative tool. By maintaining a strict thermal window, it can genuinely stimulate collagen and treat the debilitating symptoms of laxity and GSM without the tissue destruction of ablative lasers.
However, the technology is undeniably only as safe as the practitioner wielding it. A stark contrast between the successful clinical trials and the FDA's severe warnings really boils down to the necessity of accurate anatomical diagnosis and the dangers of the aesthetic industry exploiting regulatory gaps. Medical bodies are holding their ground, demanding that patients seek conservative physical therapy first and waiting for long-term data before changing their guidelines.
It really is a classic medical standoff between rapid technological innovation and the slow, necessary caution of clinical science.
It absolutely is. And looking at how heavily this safety relies on the operator's diagnostic skill, it leaves us with an interesting future to consider. If the primary danger of temperature-controlled RF isn't the heat itself, but human error like treating the wrong anatomical conditions like mesh or prolapse, what happens when the technology evolves to diagnose the patient automatically?
Oh, wow, that is a fascinating thought. What if the next generation of these wands has built-in diagnostic ultrasound?
Right.
What if the wand itself can scan the pelvic floor, detect surgical mesh, or identify a prolapse, and simply refuse to unlock the RF energy if it detects a contraindication?
Because if the device becomes smart enough to bypass human diagnostic error entirely, it could theoretically eliminate the very risks the FDA is warning about. It raises the question, if AI and automated safety mechanisms reach a point where the wand is a better diagnostician than a med spa technician, will regulatory bodies eventually be forced to approve these as at-home, over-the-counter devices for symptom management, just bypassing the clinical bottleneck entirely?
It would completely upend the regulatory landscape we just spent this deep dive exploring. The technology is moving fast, and the safety mechanisms are only going to get more advanced. But it requires us to keep asking the right questions, to demand qualified medical oversight in the present, and to look closely at the science behind the marketing. Thank you for joining us on this deep dive. Keep questioning, keep learning, and we'll catch you next time.